Women are not the only ones who suffer from menopause. There is such a thing as male menopause. We spoke with Dr. Nicole Ortiz, a naturopathic doctor at the Live Well Clinic in La Quinta, California, who tells us more.
Many people are unaware that a man can go through menopause. Well, actually, we call it andropause for a man, and what that means is that they lose their testosterone and sex hormones in their body. Completely natural process that happens to every single man. It's just a timing issue. Some people go through it and start to go through it more severely in their 30s and 40s. Other people notice this decline in their 50s and 60s. As a man enters andropause, whether he knows it or not, he'll notice some pretty significant changes. Most notably, they're more emotional. They might be sitting next to their wife and find themselves tearing up to a movie that they would maybe be laughing at. Also, in the gym or exercise, they just don't quite have that strength or that extra zip. They're not able to maintain their muscle mass. And instead of muscle mass, there's more coming around the midsection and especially in the way of fat. Other very significant portion is your libido. Your sex drive decreases quite significantly as you lose testosterone.
Dr. Ortiz examines the diagnosis and treatment options.
If you're wondering if your testosterone may be low, it's important to get a test from your doctor. So what I do is I'll run a test. There's blood or urine tests that both adequately assess the amount of hormones that are in your body and your levels. If they do come back low, we can do something to treat that. If you're low in testosterone or your sex hormones, it can be beneficial to replace them with bioidentical hormones. These are hormones that are made the exact same chemical structure as what's found naturally in your body. Taking hormones is relatively simple. Testosterone in particular for a man can come in the form of a cream that's very easily applied onto the body. There's also implants that you can have done by a doctor or injections. I find the easiest and most natural way to do it is just apply it through a cream.
Dr. Ortiz told us what a patient can expect after taking these hormones.
After treatment with the bioidentical hormones, most often you'll notice after a few weeks an increase in your sex drive or sense of well-being. You might notice that you're able to control your emotions a little bit better and pick up that lean body mass that you just can't seem to get in the gym anymore.
Dr. Ortiz told us what other conditions would warrant a testosterone prescription.
I also prescribe testosterone for other reasons that are very important. Two very large risks in a man, aging man, are heart disease and health of their bones. Testosterone is intimately important in both of them, decreasing your risk of heart disease or heart attacks and also keeping your bones strong. Men can have osteoporosis as well. So this treatment isn't just about feeling better or looking better, it's about preventing these chronic diseases.
How often would someone need these testosterone treatments?
Testosterone treatment is something that you do on a daily basis, and it will benefit you as long as you take the treatment. If you do choose at some point in your life that you want to discontinue treatment, eventually your testosterone will begin to decline, just as a natural process happens. The bioidentical testosterone comes from a compounding pharmacy. That means that the pharmacist there actually makes it especially for your dose. Not every man needs the same dose of testosterone. So the compounding pharmacy will put it into a cream, and then it's individual for what you need.